Most people think aging is declined, but the people closest to death often have the deepest hunger to live. We're not here to help them fade out. We're here to help them thrive, says Jess. Jess, I appreciate you joining on, man. Thank you so much for doing this. You're in the other side of the country in Salt Lake City, is that correct?
That's right. It's great to be with you today. Couldn't
Yeah,
be
man. What is the
happier.
weather? What is the weather like in Salt Lake
Oh,
right
well,
now?
you can maybe see a little bit behind for those that are viewing this, but it's a blue sky day here in Salt Lake City. It couldn't be more beautiful. I'm new to Utah. I've relocated to Utah in the last few months, and this is an incredible place to be for sure.
So no regrets moving to Utah?
No regrets yet. I mean, the jury's still out, but no, I don't think I'll have any regrets.
I love it. And tell us what did you move to Utah? Clearly, it was the opportunity that you've had. What are you doing nowadays, Jess?
Yeah. Well, so the opportunity to join an organization here in Utah, based out of Salt Lake City, was really the impetus for our move. And the opportunity to grow something and to continue to grow something that's been such a part of the heart of Utah, the communities within Utah that are served, and also to expand the reach of this organization nationally is really what's intriguing. I've joined the Larry H. Miller group under the Larry H. Miller Senior Health Platform, and am very involved in the strategic outlay for the platform of senior health, and also the development and the establishment of a traditional long-term care business and service line within the platform. So
And we'll get into more about the organization itself, man. But the last time I spoke to you, you said you've lived multiple lifetimes before this role. What through line connects all of them, and what pulled you into senior healthcare, man?
You know, I think that the thread of my life, the why, and it's been something that was established through or as a part of me as I grew up and entered into college and the workforce. But that why has always been to serve vulnerable communities, marginalized populations, individuals that may be in a very vulnerable place in their lives and that may require some advocacy, intervention, or a framework of support that will really help them to thrive in the midst of their challenges. So that's my why. That's the common thread throughout all of the lifetimes that I've lived. I really kind of live that and try to live that every single day. And senior care is a natural extension of really approaching a population and a people. I often say this is the most vulnerable population and the most venerable generation that we as a country have ever been able to witness. And we see the two at the same time, the vulnerability and yet the venerability of this aging nation and population of boomers. And it's really kind of strikes a chord for me where I want to be oriented toward assisting and advocating and even creating really positive, innovative change within a grouping of people that may have some very unique challenges.
I love that, and I can imagine that you can vouch for this as well. These are the most passionate people about life, the ones that are at the end of it. What have seniors taught you, man, that other leaders probably miss?
I think that's exactly right. I've found that in my own kind of personal contemplative or meditative practice, I'm always seeking to be really present and really centered in what I'm doing and very intentional. And it's a struggle for me, right? And I've been working at this for decades. And yet, what I've learned from seniors is that it seems to come a bit more naturally. And maybe it is because they are very serious about living. They see that there's a timeline that they're facing, and that they may want or need to be a bit more intentional about how they spend these latter years and how they dedicate themselves to their own personal growth, development, and journey as they see kind of the horizon and the sunset approaching. And so I've found that when I'm with seniors, yes, there's a vulnerability there. Yes, there's also an incredible strength. There's the knowledge and wisdom of the ages that they contain wholeheartedly. But there's also this incredible intentionality behind all that they do, how they spend their time, where they choose to be, the type of interactions that they elect to have, who they prioritize, and who they really treasure. And also that translates into healthcare and to their wellness journey. Which avenues are going to provide them the greatest opportunity for quality and wellness and for thriving. And that's what I learn from seniors every day. It's what fuels me and helps me to also be very much more intentional about my own practice and being present.
And I can imagine there's also the story behind it all, right? And this is a special organization because before this, Gail Miller, they were selling jazz, they were selling dealerships. Then Gail Miller chose healthcare, specifically senior care, as the next chapter. Why?
Yeah, I mean it's an incredible pivot, and it's something that I think is to be really seen for what it is. Here is a thriving family office and with a lot of interests, all of which, however, have been centered in and rooted in community and in enriching lives. And I can't speak for the Millers in terms of why they pivoted the way that they did towards senior health. I am grateful that they did because just that in and of itself is an incredible testament to the importance, right, of really taking good care of our seniors. But I will say this, I know that if we look at the greatest of themes nationally, and we look at the greatest of threads that might really impact the future and the future of generations, that one of the main threads is this growing aging population of boomers, the silver tsunami of sorts. And the promises that we as a country have made to our seniors, that we will care for them, that we will provide them a dignified and an incredible journey as they age. And I'm worried that we don't have, given the impending and the increasing demand, I'm worried that we don't have the ability to make good on those promises. And I'm grateful to be part of an organization that has that viewpoint, that has a 100-year plan, and that is saying, hey, this and these promises that we've made to this generation are crucial. They're crucial from a generational aspect. They're crucial from a national, from an economic, from a wellness perspective. And we're going to pivot and invest heavily so that we can be part of systemic and significant change.
And you guys have a pretty cool mission, enrich lives. How do you measure that, though, when your real goal is more birthdays, more 4-generational photos, more meaning?
Yeah, I mean, it's a simple statement, isn't it? Enrich lives. And I think that there are lots of ways that we can measure it. I think that we see that the measurement comes through the avenues of just what you said, the extension of life and of life's journey, providing for more milestones to be had within families and within communities and within the lives of individuals. I know that we recognize and are recognizing more and more that there's an incredible body of literature and research that shows that development doesn't just happen in the early stages of life and childhood, but development continues to happen throughout our entire lifetime. And adult development in particular tends to have a real impact upon not only the life of the individual, but the lives of our communities, that living enrichment. I see the impact of the Miller family here in Utah, where communities are being built, where there's a wellness and a focus on wellness, where there's a sports and entertainment focus to really provide for a little bit of fun and a little bit of work, right? The opportunity to do so. And that's kind of the founding language of that Gail and Larry H. Miller really began with, is let's have a little fun, let's do a little work, and let's make a little money so that we can create a virtuous cycle, right?
I want to go back, Jess. We talked about how you're here, you got here,
Yeah.
but before this, who was Jess? What was Jess doing before he got into the senior care?
Oh, before senior care. Well, I started as a phlebotomist in a pediatric hospital, and
Wow.
I was the guy, I was the vampire, so to speak, that would work in the NICU and the PICU with incredibly fragile, human beings, and holding life just in my hands and in the balance, and doing important work with a needle. It was kind of interesting to see how we could create wellness, and how the diagnostic testing that came from that really did promote and prevent, right, untoward outcomes, but also it was life-giving and life-affirming. I went from there into hospital and executive leadership through the avenue of women's health. Women in the United States and across the world, right, have always suffered from very specific disease states and conditions that have never truly been researched or addressed or even solved. And I think that we had an opportunity, and I had an opportunity to dive deeply into, why is that? Why are women experiencing health concerns and conditions, especially in pregnancy or related to pregnancy, that have never been solved? And we wanted to kind of crack that code and see if there was some protective factor or some preventive element that we could make a difference and a change in. And then, from there I went into hospital executive leadership, and then pivoted into post-acute healthcare. I have to say, there's an incredible body of mentors that are very people and patient focused. And I've been the beneficiary of these individuals, these mentors that have been truly anchors to me as I've grown in this work and in this kind of calling, right? I've never seen myself with a career or pursuing a career. I've always wanted to be aligned with more mission-driven, calling-specific activities.
I love that.
So a little bit about me professionally, but outside of the professional realm, I have an incredible passion for life, for being outdoors, for rock climbing, and for hiking. I have a meditative and contemplative practice that's really important to me.
Salt Lake City kind of fell into that then.
Salt
You
Lake
like the
City.
outside, the
The
hike.
the energy here. I mean, I was saying the other day that I feel like the mountains here in the Salt Lake Valley are so big and so present that it almost feels as though they're kind of reaching up to just eat us and consume us. They're so
Oh
close.
man,
And
I'm jelly.
I love that.
I love it. I clearly I'm in Florida. There's not really a lot of mountains here, okay? So when I do see the mountains, I do appreciate them. But man, what a fascinating just career where you start at the beginning of life, and now you're working with those towards the end of their life. Like you really got to see both sides, and you really got to learn so much, being the leader that you are today. But I ask you, I feel like there's so many prominent leaders in our lives that we can kind of tap back into and remember what they said to us that allowed us to continue to kind of get over that hurdle. Anything come in mind? Any leader, any moment that you just remember that you still cherish and carry with you today?
Yeah, I remember that there was an individual who was really, and in a way that didn't make any sense to me, was really cheering for me, that was really kind of pushing the envelope and advocating for me at a very young age. I think that there was an opportunity that I had to move into a leadership role that maybe was a bit untraditional for an individual of my age at that time.
Yeah.
And I remember him saying to me, he said, "Jess, there are times in our lives where every one of us needs to have someone who will pound the table, that will pound the table or put fist to the desk and say, no, this is our guy, this is our girl, this is who we want and who we need in this role, this is who we want to invest in, and this is, who we ultimately will benefit from the most." And for whatever reason, he felt like that was me for that given task or assignment. And I always remember that, and I try to pay that forward. I think that there are a lot of times that we maybe hedge a little bit and try to find reasons not to bring people in to such important work, especially with vulnerable patients and
Yeah.
populations. And instead, I tried to pay forward this concept and this idea that no, like I'm okay, and I will pound my fist on a table to make the case for someone who wants to be an active participant and a compelling part of this story that we're telling.
That's what makes you a great leader, man. You're still living by those same things that someone poured into you, and that's what's so good about life, man. Things that are being poured into us, and I can imagine working with senior care, you're really getting poured into. Like these are humans that were out there that were CEOs that were running their own companies that, in reality, you learn from being around every single day. That really pour and fill our cups when we think that we don't have it all together. Am I sitting here saying anything that's not right?
No, you're absolutely saying everything that's right. And I think that there's an element here that as we lead forward in senior care as an organization, that's at the heart of what we're seeking to do, and something that we want to do different and better. And that is to really tap in to the wisdom of the ages of those that we have the privilege to care for, to collect the stories, to help them live out the remainder of their desired story, and to have these opportunities to bring forward the richness of culture and of experience and of lives lived in such a way that we can enhance the future and really build together a future that looks much brighter and that's even more prepared, right?
What does it take practically and culturally to build environments where people just feel forgotten,
Yeah.
but feel more alive? Or sorry, don't feel forgotten, but feel more alive. I apologize.
Yeah, I think that there's an element. Well, one, we have to have our systems dialed in. There has to be, right, competency in all that we do technically, right? There's this element of what we're doing that is very much at the heart of healthcare and of caregiving, and oftentimes those care pathways, the providers that we engage, the clinical decision making, the ability to maintain and achieve high quality outcomes clinically. Those are really, really critical. And I feel that if we can really dial in those systems and have a significant, right, recurrent or repetitive success factor behind our clinical provision, that's kind of the basis. But from there, I think that's then where we can do exactly what you've just mentioned. We can do more. We can do more that surprises people. I think that there's an element of unexpected hospitality, where if
Yeah.
we can every day bring people that we're caring for into and foster a state of awe and wonder, or help them to experience a moment of remembrance, and be trained in such a way that they feel as though they can remain right in that place of wellness, of remembrance, of awe and wonder. I think that's where opportunity really exists, and that does tie us very tightly into the hospitality kind of industry, right? We see
Yeah.
some of these practices in the everyday businesses or restaurants or hotels that we go into. How often, though, do we see it in what can be a very sterile, impersonal healthcare setting, right?
Where experience really matters, right?
Where
Experience really matters at that moment.
it absolutely does. I mean, when you're in your hardest or most challenging of times, when your body has broken in some way and you're looking and waiting for it to heal and become well again, and there's all of the uncertainty swirling around you, it's in those precise moments where I believe that as operators, right, as individuals that are tasked with this incredible honor and privilege to care for people, that's where I think we need to do the unexpected. We need to go the extra mile. Of course, we have to have that foundation of technical expertise and consistency, but we also then can't stop there, right? This is the trust that's been given to us, and we've got an opportunity to, especially in a custodial or in a long-term care setting, where individuals are coming to live in our buildings with us and around us. Right? We have an opportunity to create that home family environment and do the unexpected from a hospitality standpoint.
Hey, real quick, if you're enjoying the podcast, we first want to say thank you. And we also just want to give you a little insight of what we're up to at Francis. Some don't even realize that we're working with organizations to help them use AI to create that real human communication experiences, whether that's actually supporting your families, those patients, or the entire community. We're actually creating tech that connects. Check it out, francis.ai. I'm just listening the whole time. You're like a storyteller. Like I'm just sitting here and just the highs and the lows and the pauses. I'm like, he's a storyteller. Do you tell stories often? Do you enjoy telling stories?
I mean, no, I don't. You're just bringing it out in me, I think.
You're so good at this. I want to go back to the Silver Tsunami. Everyone's talking about it. What's happening right now is that we have a caregiver shortage, right? Kind of actually already here. How are you thinking bigger to prepare? Some thinking AI. You mentioned something unique that maybe people are not thinking about. What are some of the things that you guys are working on to make sure that as we continue through the Silver Tsunami, that the caregivers shortage is goes away, that we have people in this space that have the passion and the purpose?
Yeah. I mean, one thing that I've learned and that I've tried to practice in my daily life has been, do we see ourselves from a scarcity mindset and mentality? And is that as productive as it could be or needs to be? Or should we pivot and start to see ourselves from an abundance perspective and mentality? There are caregivers, there are individuals who are care minded. There are those that are seeking second and third careers. There are those that are seeking first careers in the healthcare space. And then there are those that are already involved and engaged. I think there's an opportunity for us to also create an environment where individuals want to come together in a compelling way to solve the problems of today. And you hear about the staffing crisis across the country, and we are not immune to that. We see those challenges, we experience those challenges in our operations every day. But there also are bright spots where we really try to focus our attention and tell the story of what's happening in facilities. There's one that's just 15 minutes from me, where I was hearing kind of through the grapevine that they had a waiting list of CNAs and of RNs, nurses, individuals who wanted to work so badly in this facility of ours that they were placing and creating a wait list, so that when there was attrition or when there was some turnover, which in this particular building there's not a ton of turnover, but when that did happen, that they would be first up for an opportunity to work in that setting. This is something that I'd heard about and I'd kind of become curious about, and I had to get there in person myself to see it. And I went to the building and I met with the administrator, who's an incredible guy, very, very much committed to senior care and to wellness. And I asked him, I said, is this true? Do you have a waiting list of CNAs and nurses that want to work here? And he said, yeah, we do. It's an incredible blessing that we have
Sure
that.
is.
We don't take it for granted, but we do. And I just said to him, what do you think that it takes? What is it that's different about your building? And we see this not only in his, but there are others where we see this phenomenon happening. And I think that it really drives home the point that leadership matters, right? That coming together for a common cause that's higher than ourselves and being aligned in that pursuit of our highest selves and in delivering our highest quality of life and wellness and care. There's something that's very attractive about that to people. And I think that there's a lot to say about having and creating and fostering a culture where people that are skillful and that are mindful and that want to be involved in solving the problems of today from a healthcare standpoint, they will come and they will find that common thread and also will seek out that experience, right, that we and a lot of our leaders really hold true to, which is to carry forward and be the most excellent 5-star care provider that we possibly can.
J- Just I keep smiling because you're so good at this. Okay, you're so good at this. I'm like he's just giving us all we need. What I also loved about you, your leadership is you said you were not afraid to go into someone else's establishment and figure it out. Ask questions. So many people, they want to grow, they want to pivot, they want to scale, but are too afraid to go and ask questions, too afraid to go to their competitors because of the pride or the ego, whatever that may look like. Just said, no, I love this. I'm so passionate about it that I just need to figure it out
Yeah.
for us, right?
I listen, and I feel really strongly about this. You mentioned the word competitor. And boy, if there is an arena or a sector or an industry where we actually do not need to compete with each other, it's in senior care, right? We have 11,000 individuals that are Medicare eligible every single day in this country. We have a tsunami of boomers that will enter into this post-acute care continuum that will need each and every one of us at our highest ability and at our brightest moment, right? And we see in markets and in communities where the complexity and the highly regulated nature of our industry gets the best of them, and they're closing their doors. And yes, we do see some growth happening, which is exciting. And actually, we need all the growth that we can get. But I'm not sure that we need necessarily to have or subscribe to this idea that we're competing with each other. This is an industry that doesn't hold and carry a lot of secrets, right? We're highly regulated. All of our survey documentation, all of the findings from each of these surveys, all of our regulatory compliance measures and metrics and accountability to the public is readily accessible. There are no secrets. And I do think that there are opportunities for us to dispel this idea of competition. Competition drives things, right? It drives high
Right.
quality, it drives star ratings, it drives us to be our best, right? So there's something really, really positive about a competitive environment. But when competition becomes divisive, or when we begin fighting for our piece of the pie, and yet fail to recognize that the pie is actually growing exponentially, that is, I think, where we can get into trouble. That's where I think some lack of transparency can creep in. That's where maybe some lack of collegiality or collaboration can happen. And I will say this, I'm with the Larry H. Miller organization now in senior health, but I haven't always been. But I have in my past lives and with other organizations. I've seen an opportunity where I was standing and where I was operating, there was a need for me to drive, to serve a greater community, to increase my ability to share an experience of wellness with others that they just weren't gaining access to. And I would oftentimes go and seek out my competitor and say, how can we work together? Our
Yeah.
model may be slightly different, but I think there's some complementary
Yeah.
elements here. And how can you feed me, and how can I feed you, and how can we create an experience that's highly coordinated, that's lockstep with the goal and the mindset of extending wellness life and doing the best that we can for these people that we're entrusted with. And I think that's
I
really
love.
critical.
Yeah, no, I love it from a leader perspective. It is realizing that I used to always get this question when I give knowledge, like, man, you just always willing to give the knowledge. And I'm like, yeah, because there's plenty, as you mentioned, the pie, there's plenty of pie for all of us. And we can actually conquer more together. We don't have to sit here and feel like we got to hold everything when we can't really support everybody. But what happens when we come back to united? We come stronger. We can help more people better. You talk about the experience and doing it better if we could just come together. So yes, we're in a space right now. The country feels it. We're very divided. But I love just that you're not letting that get to you, man. You're working with others, those around you. You're making yourself comfortable in Salt Lake, in just months. So that's actually cool as well. And what's one mindset shift you hope every healthcare leader actually makes after hearing this? I feel like you got so much insight in this space.
Wow. That's a good question. Um, I think there's an opportunity that we have as as leaders within post-acute healthcare and in healthcare in general, I think that there's a call to action that we probably, if we listen closely, we're beginning to hear. And for some of us, we might need to tune up our hearing aids a little bit, or tune in a little bit more intentionally. But I think that at the heart of this, right, is the opportunity that we have to create something really different, really special for our seniors. I find that there can oftentimes be a real strong appetite to come into this sector, to invest heavily into the sector with the idea and the intention to have a really short-term, quick payday. And sometimes I find that, in my opinion, can erode the very nature of the humanness of the work that we're doing. And what I would say is that we be a little bit more tempered in our appetites, and look at long-term care with a long-term view, and with a desire, yes, to achieve long-term results, but to never sacrifice what is needed for the longer arc of wellness and time, for that which can be so fleeting in the moment, right? And so that's, I think, where I would say, as an industry, I think we can do better. I'm grateful to be part of an organization that has a 100-year plan. This is a long-term mindset in a long-term care setting with long-term care goals and outcomes, and that's tied into a virtuous cycle, right? Where we believe that the way that we can enrich lives, the ways that we can enrich lives matters, and the results, and even the financial results of that, can still matter even more greatly and more deeply if we funnel those funds into philanthropic endeavors that, again, continue to give back into our communities and invest in people. And I would say that that's probably what drives me and what drives us as an organization in senior health, is to take things into perspective and say, hey, what does the long arc of time require from us? You know.
So we spoke to those leaders, and I loved it. Let's speak to the everyday people.
Yeah.
Most of us, we either age or help someone who is aging.
Yeah.
What do you want families and communities to do differently, starting now?
Oh, wow.
You got the words, I know. Because listen,
it's hard.
You're a storyteller.
It's hard to know where to start. Listen, I think becoming really well informed is important. There's been a lot of effort to create transparency and to create an opportunity for individuals to learn and know where quality care resides and where it doesn't. There's also an opportunity to engage very directly with those in our communities that may be marginalized, that may be vulnerable, that may have limitations and barriers to accessing care, that we can really help and facilitate. I think that there's also an opportunity for us to pivot toward a mindset of caring and caregiving. And I wish in our society at large that there were more of a multi-generational view of caring, of living, of communing, and of being, in this together. I think that there are pockets and places where this is so strong, and if we could just tap in to those aspects and elements in a world that increasingly motivates and incentivizes us to be siloed and individualistic and self-motivated and even egoic, if we can set those societal pressures to the side and say, no, what matters most is community. What matters most is communion. What matters most is caring. I think that is where we should be looking to center our lives. It'll
have
pay the biggest dividends, I think, in the future.
Do you have a spiritual background?
I do. It's pretty.
Tell.
I would say
I can
that
definitely tell.
I would say that it's a matter of wanderlust. There are those that wander the earth barefoot with long hair and braids. I've done that in my past.
That is too funny. I
Um,
need to see that.
I'm
Exactly to
definitely
get us that.
there's a side of me that's super hippy dippy, so you have to bear with me when you hear me say things that are a little bit more cosmically oriented. But yeah, like I think that has to do with what motivates me and what really is important to me, and that is alignment with
Yeah.
what I feel to be or see to be of a higher stature, or of a higher nature, right? This thing, this effort, this calling that's bigger than ourselves, right?
I agree. I
I think
agree.
that's really important.
What is your, as we start to wrap this up, what is your vision for senior care in the next, let's say, 5 to 10 years? And what is it going to really take to get there?
Yeah, I do see a pretty clear pathway forward. I see a pathway where quality providers come together to grow and to serve communities collectively. I see an opportunity for us to really leverage the strength of our acute care systems to really funnel and flow individuals through a highly coordinated system of care. There are so many complexities that people may say, well, that's just never going to happen. It's not going to be possible.
Yeah.
But I see us being very intentional about growth. I see us being very intentional about the way in which we design and grow and evolve our clinical practices to meet the needs of tomorrow. We're seeing greater and greater chronicity, greater acuity and complexity. I think that there's a need, as we all know, for preventive care and health. But in the face of that not necessarily being true for all of us, we also need to have, the way and the means to catch and to cradle people in their moments of greatest need. For the foreseeable future, I see there being kind of an opportunity to differentiate, right? To support the mom and pop operations that are doing absolutely their best to care for individuals in their communities, but to provide maybe a backbone of support and of service that will allow for us to be connected, allow for us to kind of take down the walls of competition and look at ownership not necessarily from the lens of assets, but look at ownership from the lens of communities and of experiences. How well are we owning the experience of our seniors today?
Yeah.
Is their experience as rich and full an experience as we would hope that they would be having, or are there ways that we can come together to do better and do more? That takes something that I think is really unique and really important from a Miller family and from a Larry H. Miller company standpoint, and that is this patient mission-driven capital, right? The ability to say, hey, can be a bit more patient than other investment entities or approaches within this space. We can absolutely be centered in our mission, and we can bring forth a product line that is not only successful from a business lens, but that then continues to feed through this virtuous cycle, the philanthropic efforts and endeavors that at the end of the day will create the structures and the foundations of communities that will build a better future. So
I would say you were definitely the right pick, okay, to run this organization. I ask you this blind question as we start to end this up, man. So it's hot seat time. What's one thing you used to believe about aging or elder care that really turned out to be completely wrong? And what did learning the truth cost you?
ooh, that's a good one. I think that here's one.
I'm ready.
And I might. So you have to forgive me because I also wear my heart on my sleeve, and anybody who knows me knows that I become kind of emotional, and maybe
Me
even
too.
tearful.
Don't worry. That's two of us. That's both of
Right?
us. So please don't make me cry here,
Maybe,
okay? Just I will cry with you.
Listen, it was in the early days. I was a brand new executive director as a newly licensed nursing home administrator in my first building in Arizona. And there was a particular resident, and she was just that kind of warm, loving, caring individual who you just wanted to be around, and who was just living this life of fullness, even though her body and her mind were starting to fail her. And you could see it in her eyes, you could see it in her demeanor, you could see it in her smile. You just couldn't see it represented in the way in which she could stand or carry herself, or even sometimes, walk and ambulate or do things on her own. And I became kind of weirdly, kind of interested, not weirdly, but like interested in, as any caregiver would, in her well-being. And I knew that her time was coming to an end. And I said to myself, I also knew that she didn't have any family. She was never visited. She never had or spoke of people in her life who loved her. She spoke about people that she loved. But it wasn't necessarily, I felt like she was fairly alone in her journey. And I always said to myself, listen, I'm never going to let her leave and transition into the next phase of her life and living alone. Well, one day I had this sense, and I got in my car and I was driving as fast as I could to the facility, and I went into the building not knowing what I would find or why I was feeling this angst, and I ended up right in her room and saw an empty room. And it was a moment of just, it was a moment of like reality, right? Where it's like, wow, she was alone. How could I have let this happen, right? I'd always said that I wouldn't let her transition or leave this life alone, and yet she did. And at the same time that I had that thought and was thinking those things, I had a second thought, which was, no one dies alone, right? There are unseen forces, and there are ways where absolute grace comes into the picture, and that's one thing that I've gained knowledge of, is that we, as we live this life and we work through kind of the realities of life and living, that we're never alone, right? There's always going to be an opportunity to connect and to be connected with others.
And I think, through that story of you just being there, right? Those few times of just pouring into her, she wasn't alone, right? Like, she had that person. And I think just that's why people that get into this field, they don't do it for the paycheck. They truly do it out of the passion, the purpose, and knowing that they're helping others. You've helped her along that journey. You helped her feel just a little bit more at ease every time you stepped into the room, because she knew somebody was there to see her, right? And sometimes we just have this calling to do what we do because of those reasons. Sometimes we overextend ourselves and we don't know why. I'm pretty sure it seems like you're that guy that just overextends and it probably says yes to more things you should be saying no to. But it's truly out of the love, because you care, and you cared enough, right, to show up at that day. But she didn't die alone, like you mentioned. Yeah. But what a story, man. What a story to really end up on, man. And I'm just like you. I don't know why sometimes I'm so emotional. I'm glad that you called it, because you prepared me for it. So I was trying to hold it together over here, Jess. But there's always something to learn from every experience that we have, man. I'm pretty sure that there was something to learn from that moment, as you mentioned. So I truly do appreciate you. Where can more people find you? Because if you're not doing content around this, you should. Your voice is one of those, like, Zach didn't tell me you were a storyteller. I'm sitting here like, no, Jess is a storyteller. Like, I'm so into what you're saying. It's so funny. Where can people find more of you?
Right here. I mean, you're at, listen, I don't do a lot.
You don't do a lot of content?
No, not at all.
Oh, man.
I just have found that if I can touch the lives around me, if I can expand my circle of connectedness and influence, and if you know anybody that knows me well, you will hear them say, right, I live kind of this theory, this philosophy that every single person that I have an opportunity to encounter, whether it be a casual passing in the street or riding an elevator or making eye contact as we pass on a sidewalk, I feel that every single interaction that we have is purposeful. I feel that those individuals have crossed our paths for a reason, and there's some Eastern thought around this, which would be, that every individual has had a part in one of our 1,000 past lives or one of our future 1,000 lives, right? And I kind of try to live in that way. So I don't do anything to get out there. I just try to do more to kind of dive in,
You live in the moment pretty
inside
much.
myself and inside other people so that I can get to know.
Okay, so what is the organization? If someone wants to know more about the organization, what is the website?
Oh, well, we are Larry H. Miller Senior Care, or Senior Health, I'm sorry, and lhmseniorhealth.com.
Okay.
That will be a great way to get to know who we are as an organization, and of course, our organization, our parent organization, Larry H. Miller Company. It's a well-known name and family here in Utah, and as we extend our operations nationwide, we hope that more and more of the virtuous cycle and of the enrichment of lives that we really are focused on will touch a greater expanse of people and communities, and that's our goal.
Well, thank you, Jess, for your time, man. Really do appreciate it. I definitely see that you'll continue to grow, not only within this organization, but just as an individual, just speaking to you, just having a heart to help, to give, So thank you so much. If you guys are watching, make sure you guys do like, subscribe, and comment. These are the conversations that we really, really love with leaders that are authentically them, wearing their heart on their sleeves. We couldn't thank you enough.
Well,
I'm
thank you.
Efrain. Yeah, this is Jess. I'll catch you on the next one, Jess. Later.
Great.